3 hybrid anchor construct fixation in skeletally immature patients with tibial eminence fractures. All authors declare that they have no known competing financial interests or personal relationships that could have appeared to influence the work reported in this paper. Remove the proliferated soft tissue and hematoma to make the surgical field clearer. Observed via the AL portal, and used a probe from the AM portal to attempt the reduction of the fracture fragment. Plan and determine the position of anchors. Then marked it with a shaver, screwed the first anchor into the pre-marked point. Intraoperative X-ray fluoroscopy was performed to ensure that the anchor position was on the proximal epiphyseal. A PDS was used through the distal part of the ACL with a hook. Pull the threads of anchor 1 around the front of the ACL from the outside, and then pull the threads around the back of the ACL from the inside in the same way. Next, an additional AM portal was established in the more distal and lateral position of the standard AM portal. Combined with intraoperative fluoroscopy, the second and third anchor was implanted on the AM and AL side of the tibial plateau respectively. The thread tail from the previously implanted anchor 1 was passed through the medial and lateral 2 suture anchor, respectively, and held in place, then cut the residual thread tail. Finally, observe the intercondylar fossa as a whole again and use a probe to check the tension of ACL.